bad. Probably because you didn't get an IV. I'm Gina, I'm a registered nurse, and I want to help you guys feel more comfortable doing IVs. When I was in nursing school, I didn't really have the chance to do IVs at the bedside, and so here I am. I had to practice on random items that I found at home, and so this is really just a way to show everybody, baby nurses all the way to the nurses that have been nursing for 40 plus years, how easy it is to learn how to stick at home from the comfort of your home in slippers. Let's get started. So first, we have to think about what we're gonna need to start our IV. I like to generally start out with a flush, a Lorlock, and some tubing systems for this. Alcohol pads, obviously. Keep it clean. A tourniquet, and a pad. If I'm forgetting anything else, I'm sure I'll probably just edit it in this video. All right, so let's go ahead and so here we go. We have all of the stuff that we need to set up. We have our flush, we have our alcohol pad, we have our patients, we have some hand sanitizer, keep it clean, and we also have our tubing and a tourniquet. And I have gloves. I'm not doing this with my bare hands. I got it. I got the gloves, okay? All right, so we're gonna start prepping our patient. So first you wanna tell your patient what's going on. You're gonna get an IV today because you're dehydrated and you look sad, clearly. Just sadness issues. Okay, and that's okay. We're gonna fix you up today. So, oh, how could I forget the most important part? The needle. Oops. All right, so we have the needle, we have our flush, we have our alcohol, we have our tourniquet, we have our Lorlock and tubing system, and we have hand sanitizer. Okay, I'm gonna keep it clean, ladies. All right, and men, everybody stay clean. So here we go. So first you're gonna go in, talk to your patient, tell them what you're doing and why you're doing it. I think that's one of the most important things that people don't, they just go in and they say, okay, you're getting an IV today, but it's important. So Mr. Banana, you look really sad and depressed, and I get it, because, housing prices are crazy and I can't pay rent, but you just don't seem right, and I think maybe you have some increased potassium. It's a joke, because it's a banana. Yeah, so increased potassium. So you are gonna need an IV so that we can give you some meds and so that you feel better. Great. All right, so let's go ahead and get started. So we have our banana. We have our flush. First thing we're gonna do is get our hands clean. I personally like my gloves to fit a little tighter because I can feel the veins a little bit better, easier. So I like to wear smalls. My hands are generally a little small. These hands? You know what they say. So I am going to go ahead and get, and my glove broke. Okay, well, that's fun. Okay, well, this glove broke, so all intents and purposes, and I lost my other ones. So we're just gonna keep going. So Mr. Banana, he's ready. So we're going to take our alcohol pad and we're gonna pick a vein. We're gonna pick any vein that we see fit on Mr. Banana. So there's clearly some good outward appearing veins. Veins aren't always gonna look like this, and we'll go over that in our next video. But veins aren't always going to be this prominent. But we see a great vein going down here on Mr. Banana. So you can pick whichever one you like. I think this bad boy is looking like a juicy one right there. So we're just gonna clean that area off. I'm gonna let it go because that's probably all he's doing. Okay, so we're gonna let it sit. Please do not do that. No, we don't do that. We do not like doing that. Then we're gonna go ahead and put our tourniquet on. So most people have an issue putting a tourniquet on at first. I'm just for giggles because I can't really get a good grip on this tourniquet on this banana. We're going to start like this up. I like to cross them, pull on this, pull from underneath, and pull taut there. So now we have a nice grip on the banana and the vein will pop up eventually. Hopefully, that's the plan. Sorry, this is like super ghetto, but we're gonna keep going. All right, so now we're going to take out our needle. most important part. So what we're gonna talk about with this needle is exactly what size do you need when you're starting the needle, like when you're picking a needle, and why are you picking that size. So I pick 20s, I'm in the emergency department. So I'm always getting lower gauge needles so that I can be able to get more fluid, more volume, push fluids faster, and take all of those fluids. So I always do a 20. Some people like doing 22, some people like doing 18. Is your cup of coffee? I don't know. I'm not into torture. Maybe a little, I don't know. Anyways, so we're gonna go ahead and take this off. You always wanna start bevel side up. You can see bevel is up on this. Bevel is up. So we have our nice clean spot right here. We're gonna palpate. Make sure that the area is ready to be stuck. All right, and please give a countdown to your patients. Don't just stick them. They're people too. They wanna know when something's about to go in them. Anyways, so we're gonna go ahead. Are we ready? Are you ready, Mr. B? Really, you have a thing over your mouth and you're not very happy. That's fine too. Cranky. All right, that's typical. All right, so what I'm gonna do is pull, I can't really pull the skin, but pull the skin downwards like this, down at an angle. Sometimes if you can't really get the position right, you wanna either go on the sides or you can go underneath. But for this, I'm just gonna go on the sides and pull the skin taut downwards. And then I'm going to say 1, 2, 3, here we go. And here it goes. You wanna get your needle in, you wanna be able to see flash. Clearly he's a banana, so I'm not gonna get a flash from him right now. But we're in the vein right here. We know it, we see our banana flash, and so we're gonna slide our catheter in. Catheter is in. All right, now that that's done, we're gonna go ahead and pop our tourniquet off of Mr. B. And we're gonna go ahead and put our tubing in. So in a normal, regular situation, we would have a Luer lock on this here, which basically looks like this, and this would go inside of here, and that's the second part. Clearly, I need a little bit more work on this, so we'll just pretend for now. But we're gonna go ahead and flush this through, and we're gonna wait until all the saline comes out of both sides. All right, it's not gonna come out of this side, but that's okay. It's primed all the way through. You don't want any air in this line. So then you're gonna bring this in here, and then this here. Oh, yay, look at that. Look how beautiful I'm pretty sure that's leaking, but that's okay. It's a banana. We know, we get it though. We get the point. And getting everything, my glove came off. It's fine, whatever. We're gonna keep going. But you're not gonna keep going if you're in the thing. You're gonna stop and get a new glove. I just don't have any gloves right now. Well, he's clearly experiencing hydration to the best extent. Wonderful. So then we would have our tape it down for the all in shits and giggles today. I'm just gonna go ahead and put a piece of tape down. Sometimes your facility will just have tape, so that's kind of, not too abnormal, but I generally like to have a Tegaderm of some sort to put it down, and then I'll put tape on top of that. So we'll go ahead and tape it. Makes a lot of sense. All right, you did it like that. Okay. What do you want to do? Why would you do such a small piece of tape? Okay, IV's in. Mr. Banana is getting hydrated, and we can do another video another time, kind of more on about how we set up an IV pole. We are all done. It's a wonderful time. So this is Mr. Banana with his IV, and he's happy. Yes, Mr. Banana is happy now that he now has some fluids, and you did an IV at home. Congratulations. If you really liked this video, although it was quite all over the place, please like and subscribe, and let me know which other household items you'd like to see stuck so that we can do it together. I can work on that a little bit more. We can work on it a little bit more and we can figure out something that works, but we just did the basics today. Like and subscribe and comment below on what other household items you'd like to see me stick. better than this time because we'll be better. Thanks for watching.